Hi everyone, Dr. Karam, board certified facial plastic surgeon specializing in facial rejuvenation, effectively all the things that help you look as young as you feel. And today we're going to talk about what is the difference between fillers, Sculptra, and fat transfer. I'm going to take you through one by one and discuss them all with you. But first, I'm going to give you a framework for how these individual procedures fit into the bigger picture and what is it meant to achieve. So let's break it down. So let's talk about how does the skin age. So number one, changes to the skin is changes related to the overall tone and texture and color of the skin. That is number one. Number two is related to the loss of volume. That is changes that are happening to the underlying fat pads of the skin and face, where the face begins to deflate and get thinner as time goes on. The third category, and this is kind of the big one, when things start to sag, when you start to see the descent of the corners of the eyebrows, the mid-face starts to come down, and deepening of the nasolabial fold, the presence of jowling and the heaviness of the neck, heaviness of the eyelids, and elongation of the lip. So those are the three changes that are happening with aging, and I want you to always keep those three things in mind. But specifically, where does fillers, Sculptra, and fat transfer fit in? Well, it fits into the volume category, and this is really, really important to keep in mind. This will keep you straight, because everything related to sagging, just know, is related to surgery. The tool to correct sagging is surgical related treatments. The changes happening to the surface of the skin are all related to surface level treatments. For example, sun protection, proper use of skincare, proper use of individual lasers and chemical peels, microneedling, and those type of things. That's all skin related. But the category right down the center, which is volume loss, is where fillers, Sculptra, and fat transfer fit in. Why is that important? Why do I stress that? Because a common mistake that people will make is they will actually try to use those treatments and correct problems related to sagging, etc. And that's where you start to see these faces that get ballooned up and get heavy, because people are trying to put a bunch of filler to try to lift up the face, and all of a sudden you start looking like a completely different person, and not in a good way. And ultimately, these treatments begin to build on themselves, and before you know it, you truly are a different looking person, and you can't reverse it. So, rule number one, don't use fillers to lift the face. Treat it to replace volume loss. Now, let's talk about the differences between filler, Sculptra, and fat transfer. Here goes. So fillers, in general, is a category of treatments that are effectively foreign body gels that are injected into the face. Now, some of them are made of hyaluronic acid, some of them are made of hydroxyapatite, that's like Radiesse. Common hyaluronic acid fillers are things like Restylane and Juvederm, and some newer ones that are out there. And they're fundamentally gels, and what ends up happening is you inject it out of a needle and you put it into these different places. Now, the problem is, again, misuse of them, because if you use them properly, just to softly and gently replace a little bit of lost volume in your temples, a little bit in the lips, a little bit, say, in your cheek, or perhaps under the eye a little bit, down around here, in a comprehensive and balanced way, the fillers work very well. But here are the characteristics of the filler. Typically temporary, oftentimes collagen stimulating, because once they enter the tissues, they are trying to be broken down by the local tissues, and as a result, you end up getting the problems related to inflammation, and inflammation leads to scar tissue. So that is one of the components. Some people look at that as a semi-positive thing, because you're like, okay, well, there's some scar tissue left behind, which is effectively collagen, and therefore, you're getting some permanent results from it. If it's controlled and if it's minor, that's a good thing, but if it's too much, well, now you're in trouble. And they also potentially set up for things related to foreign body reactions, granulomas, etc. Those are sort of the negatives. But in a very positive way, they can be used to touch certain areas and get immediate effects in those areas. You go into the office, get a syringe or 2 or 3 of these fillers put into different areas, and you walk out, you're a little bit fuller. The proper age group for these type of treatments typically are generally in the late 30s, maybe early 40s, before sagging starts to take place. Or perhaps after a surgical correction, you want to add a little bit of volume here and there, you can use some fillers to do so. But again, the name of the game is less is more, and use it in a comprehensive way. But again, characteristically, they are temporary, typically 6 months to a year. And they are dependent on how much you put in. The more you put in, sometimes the greater durability of the results you get, but then again, you look a little puffy and unusual. The hyaluronic acid fillers do have an enzyme that can reverse it. So if something goes very wrong, you can remove it using the enzyme hyaluronidase. So that can be used to dissolve the filler. That's a positive thing about fillers, but you don't have to worry about getting bad outcomes if you're with somebody who does this very, very commonly and does it generally very well. So that is the filler category. Common procedure done in a lot of medical spas, dermatology, and plastic surgery offices. The next category is Sculptra. This is not a filler. Sculptra is a biostimulator. It's been around for over 15 years. It is originally used for patients who had HIV lipoatrophy when they were put on medicines that would give them resistance against the HIV virus. What they would end up seeing is that there would be a persistent loss of facial fat and the face would deflate. So Sculptra came around as a way of reinflating the face and getting volume back into it. Now, how does it work? What is a biostimulator? So it's an injection that is put into the face, and the powder, which is the base of the Sculptra, stimulates collagen in the local tissue area. So as a result, about 4 to 6 weeks to 8 weeks later, you start to see a gradual increase in collagen in the areas that were injected. Generally a very good treatment for specific areas like the temples, a little bit of replacement in the cheeks perhaps, etc. But once you get around the eyes or the mouth, because of the constant movement in those areas, there's a high chance for beading. Little dots of collagen begin to form as the muscle contraction works in those areas, and end up creating sort of palpable or noticeable irregularities through those areas of injection. So I wouldn't recommend them in those areas. Deep injections are generally okay, but again, they're meant to be used to replace lost volume, not to lift or fix the problems related to laxity. Typically, it takes about 3 to 4 treatments to get the result you're looking for. So if you're going to plan on going down the Sculptra route, make sure you plan on doing it all the way through, because if you only do one treatment, you're going to be disappointed, but it's a complete waste of money because you're not going to see enough change to justify the cost of the Sculptra. But if you do it 3 or 4 times in those areas that we mentioned, and doing it again with a very light touch and a light hand in a very artistic way, it can be very promising. Now keep in mind, Sculptra lasts anywhere from 2 to 4 years. So the problem is, if you get it wrong, you're kind of stuck with it for a long time. That is a semi-permanent type of an outcome, and you got to be careful about that. So the next category is fat transfer. So fat transfer is something that I specialize in. It's something that I fell in love with literally before I even became a full-blown facial plastic surgeon. I recognized it during my residency as an important part of the aging process is the concept of fat loss. So what fat transfer is, it's basically fat grafting. And what that means is a graft is a living part of your own body that you take from one place and you implant it into another place. So in the case of fat transfer, we usually harvest it from the stomach or the thighs. We harvest it from those areas and we inject it into the areas of the face that have lost volume. So it's removed from those areas in a liposuction type fashion. So you get tiny little grafts of fat, and then you do a micro injection technique where, at least in my hands, and the way I think about it is tiny little dots of fat being placed into multiple layers of the facial tissues, depending on where the treatment zones are. Sometimes it's very deep, sometimes it's a little bit more superficial. But at the end of the day, what it is little dots, kind of like snowflakes falling on the ground, and you get this smooth overall outcome. Now, The deal with fat transfer is it's permanent. So what does that mean? It means huge advantage if you get it right. Massive disadvantage if you're in the hands of somebody who's not an expert in it and you end up getting bad results, because there's no way you can turn fat transfer around safely and reliably. You usually have to live with the results, and living with the results could mean overfilled, could be lumps and bumps, could be treated in areas that don't belong. So fat transfer definitely is one of those procedures that you need to seek an expert in, somebody who's doing this on a very, very regular basis and gets extremely good results. For example, in our practice, I've done at least over 6,000 over the last 15 years. There's not a day that goes by that I'm not doing fat transfer. In fact, I did my wife's fat transfer almost 15 years ago, actually. And the beauty of it is, if it's done properly, the results persist the entire time. And there's thousands of patients like her that I've treated during that same era, and even more recently, that enjoy that persistence over time. But again, fat transfer, despite the fact that it's permanent, despite the fact that it's natural, despite the fact that it can be a marvelous, marvelous, beautiful procedure, it is also not a treatment for sagging. So in my practice, it's usually one that's done for younger patients, and it's also done for individuals who have undergone a vertical restore, which is the procedure where I lift everything and bring everything back up into position, or it's always done with somebody who I'm doing lower eyelid surgery on. But it's not done on an older patient who's starting to see sagging as a standalone. Again, it's a very disappointing outcome, just like it would be if we were doing fillers. So similarities, these are all volume replacement procedures. Dissimilarities, as we go from filler to Sculptra to fat transfer, the level of permanence and longevity increases as we get to that point, as does the requirement to be in the hands of somebody who is very, very good and experienced and has an artistic understanding of how the face needs to replace its volume and how it should be done. Otherwise, you're going to end up looking disproportionate, and we've all seen those outcomes, unfortunately. So keep all of that in mind as you select and seek an individual to help you with these procedures. Those are the nuts and bolts and points of differences and similarities between these volume augmenting techniques. I think you get the gist. You're going to use these to replace volume, nothing else. So I hope this helped. I hope this gave you some clarity. I hope this keeps you out of trouble. If you haven't already, hit subscribe. Make sure you follow along. Every week or so, we're going to be delivering content like this. Pass it along to friends and family, or anyone you think would benefit from this information, so we can get this out to more and more people and spread the good word. Thank you so much for listening along. If you want more content like this, follow my Instagram at Dr. Amir Karam. Stay tuned. There's going to be more videos on the topic of volume and facial rejuvenation following this. So keep along, and you're going to be able to get even more knowledgeable and more information. Thanks so much.